You and your co-workers do your best to help others live a meaningful, active, and comfortable life. It's a rewarding job. But as you go about providing care and services, safety and accident prevention must be given a high priority. Among the potential risks in your facility is exposure to bloodborne pathogens, and it's up to you and your facility to do what's possible to reduce your risk of exposure to bloodborne pathogens. But what are bloodborne pathogens? Bloodborne pathogens are disease-causing viruses or bacteria that are carried in the blood. They enter the body through a break, cut, or puncture in the skin, or through mucous membranes. Every time you come into contact with body fluids, you risk transferring a pathogen into your body. Your personal lifestyle choices, including specific sexual behaviors and intravenous drug use, present the most serious threat for bloodborne pathogen exposure, just as with the general population. But as a healthcare worker, you face additional risks in the workplace. Among the most serious bloodborne pathogens are hepatitis B, hepatitis C, and HIV. Hepatitis B, or HBV, is a serious disease caused by a harmful virus. It is very infectious and can live in dried blood for as long as 2 weeks. About 1/3 of people that have been exposed to HBV contract the disease. The symptoms of HBV can be very mild, so many people do not know they are infected. HBV is fatal in 5 to 10% of cases. Vaccination is an important way to protect yourself against HBV. If you're in a job that puts you at risk for bloodborne pathogen exposure, such as nursing or laundry, your facility will offer you a hepatitis B vaccine series at no cost. If you decide not to receive the vaccine series, you must sign a form saying you understand the risks of HBV. You can always change your mind at any time in the future and receive the vaccine at no cost. Hepatitis C, or HCV, is the most common bloodborne infection in the United States. It causes serious lifelong liver problems for over 85% of those infected and is a common reason for liver transplants. There is no vaccine for HCV. Human immunodeficiency virus, or HIV, is the virus that causes AIDS. 1 in 300 people exposed to HIV contract the virus. While it's not as prevalent a threat as HBV in the long-term care setting at this time, and advances in treatment have been made, HIV is still a fatal disease.